Welcome to Techin5, where you can get your weekly tech news in 5 minutes. I'm Madeline.
And I'm Christina. This is your weekly download. Madeline, what are we talking about today?
So we just talked about some tech trends in 2021, but one that we wanted to spend a full episode on was health tech.
In the health industry and health tech, things that are important right now to come to highlight is managing patient information, managing documentation that goes with services provided, and how to maintain finances, inventory, all sorts of things that are going on. But we've talked about a couple of things that were really interesting, including using algorithms for doing patient diagnosis. So that's pretty interesting in health tech is, as technology becomes more fast and we can process larger amounts of data in a smaller amount of time, we're able to run through thousands, if not millions and millions of records and see trends and do forecasting and statistical analysis on symptoms and whatnot to arrive at a final diagnosis for patients. Super interesting. Of course, all of that requires a massive amount of technology to be able to accomplish.
It does, but not only just the technology, but a massive amount of data and specifically personal information, or PII, because you're having to know all these different factors about a patient to be able to make those formulas make sense.
Sure.
So that's another big part of it, with security playing in. You can't be going back and forth if you have a system that's not secure. And so in the same token, as we're talking about patients and getting to know them and that access for the patients, I mean, who now actually calls their doctor? We can do everything online. You can go through a portal and you can email them, you can schedule your appointments, and that's been great. But I think even to some respect with the pandemic, it's caused that to even occur even more, that security, that need for that. Because if you're having a conversation with your doctor via email, you want to make sure nothing's going to get stolen, nothing's going to be said or brought out from that.
Yeah, absolutely. And so what you mentioned is emailing to set up an appointment is probably something that we're okay with now. You're probably not sharing a lot of personal information over email, but definitely if you're sending results of a lab test, or you have a diagnosis that's being given, or x-rays or something that's being transmitted electronically, we don't want to do that over email anymore. And so it really emphasizes the need for secure platforms which are able to send data across distance securely and maintain that personal information encrypted so that it doesn't fall into wrong hands.
Right. And as much as those patients need to know that our data is safe, on the same token, we also need to know that our employees of these hospitals, of these medical centers, can access the new information that's coming out, right?
Yeah.
So even, again, with the pandemic, rules were changing so quickly, and there needed to be a hub for them to be able to get to it. And so intranets have been a big part of how to communicate this information to your staff and to your team. And so one of the things that Withum that we are really have done very well with, especially within the healthcare industry, is build that intranet, build something that can bring all that information that is usable, that the client knows how to get to and can actually adopt and use. And we've done that with our OneWindow offering that we have. So that's another thing that you have to be able to evolve with what's going on, and that's a big part of where I think health tech is going. It's evolution of what was coming.
Yes, and what you're implying in there is that there's a great burden on top of the healthcare providers to have the technology in place in order to manage that amount of data. So the intranet is one way that they can share information internally, so that's in-house, but then it also requires a huge amount of external data that has to be transmitted and shared across different platforms. And then ERP platforms that are needed to manage the amount of financial information that's being processed, maybe perhaps even to help with automated billing for services provided, as well as tracking inventory for all of the supplies and materials that are needed within the healthcare provider area to be able to provide those vital services to patients.
Totally.
Yeah.
And again, when you start bringing in financial data, that's a whole new set of rules that have to get touched, right?
Sure.
Because if you're bringing credit card information back and forth, well, you got to watch where that goes and follow the regulation that's around that already.
Sure, and that's even without mentioning insurance providers, so it gets complicated.
It goes down a hole real quick.
Yeah. Now you mentioned that there was a case study that it's something that with a client that Withum is working with that is in the healthcare space.
Right. Yeah. So that's what we did. We worked with one of our local, in the way, hospitals around here, and so we built them an intranet, and we really helped to bring all that information into one spot. It was adopted by them. We're continuing to stay with them so that they actually can continue to update as they go. And we also, because of the platform it's built on, which is Microsoft SharePoint as well as Microsoft Teams, they're able to really communicate in a new way, which they would have had to, in a world where you can't be but 6 feet apart, you need to be able to talk to your coworkers and talk to your bosses. And that's something we
Absolutely.
were able to do with this client and continue that work going.
Interesting, interesting. And so there's a lot to be said if we dig into a case study and all of the different pieces that come together. But some of our listeners and viewers might be interested in how they can find funding for these technology modernization projects.
Mhm.
And just a reminder that there is the ERTC, which is the Employee Retention Tax Credit, available that Withum tax advisors are helping some of our clients recover up to millions of dollars. There's one case study that we heard, a healthcare provider was able to recover a very sizable amount of funding through this initiative. So feel free to ping us for more information on that. So sometimes we have to get creative on ways that we find the funding that we need to drive and support other projects.
For sure, for sure. But you know what? Money is money, and that's we'll find ways, right?
Absolutely. And so technology and there's a lot of room for it and a lot of projects that can be done. We want to talk more about it, and so we'll have to postpone that for the next episode.
We will, but definitely like and subscribe so you can see there are future episodes and the new topics that we discuss.
Absolutely. Thanks for joining today. Thanks,
Thank
Madeline.
you. Bye.
Bye-bye.